Good afternoon everyone and welcome to the Western Sydney Health Forum. I'm Jake McCallum, NewsLocal state political reporter, and lovely to see you all once again this year. We're thrilled to be able to bring you this event online for the second year in a row, thanks to COVID. I'm a proud Western Sydney resident and I am excited to be here once again. I'd like to begin by acknowledging the traditional owners of the land on which we meet today, the Barramadigal of the Darug Nation, and pay my respects to elders past, present and emerging. This always was and always will be Aboriginal land. This important forum is an opportunity for the public to see what has been achieved in the last year and ask any questions about the challenges that Western Sydney Local Health District face on a daily basis. We received several questions from staff and the public in the lead up to today, but for everyone watching at home, please feel free to ask any questions you have and I'll do my best to get to them all, asking our esteemed panel here. If I can't get to the question, please submit it in the comments below and someone from the Health District will respond to you from there. I'd now like to welcome Chief Executive of the District, Mr Graeme Loy, to share a few words with you.
Thanks, Jake. I really appreciate it, and thank you for taking the time to come and see us. It's really important that we not only have a really good relationship with our community, but also with yourself and the people that come. And it's really good to have people come back so we can have an ongoing relationship that helps for all of us. Thank you to everyone for joining us. It's a critical part of our annual year to have the annual public meeting, and there are things that we like to talk about. There are some things that we have to talk about. I'll talk about the finances at the very end. It's a slightly boring piece, but there are some things that we do have to cover. I'll start as well by acknowledging the traditional owners of the lands on which we meet. We're on the lands of the Barramadigal people of the Darug Nation, and pay our respects to elders past, present and emerging, and anyone who's with us in the room or watching us online today. So thank you very much for your time. I really just would like to take the opportunity to talk about some of our achievements, because it's been a huge year for Western Sydney, and in more ways than one. And yes, COVID has played a significant part of what we've done, and we've had to address a lot of issues and step up to a lot of challenges over the year around, how do we pivot and how do we respond quickly to the demands of not just the COVID environment, but the demands of the thirst for knowledge that was out there and the thirst for information that we needed to try and assist people with. So we had a really, really broad response across the whole system, and some really, really big numbers. I was really pleased that Western Sydney, the staff and the community stepped up. When the challenge went out to say you must get vaccinated, the district stepped up really well, and I was so proud of our staff and what they achieved and how they did that. But I was even prouder of the Western Sydney community. So to go out there and really quickly, follow the rules, get vaccinated, wear masks, do all those things that we needed people to do is really, really critical. And I was so impressed. So impressed, in fact, that we went from reasonable levels of vaccination within Western Sydney to almost 95% plus for second doses, and we were one of the first LHDs to get that. So all of the people of Western Sydney, it was an amazing effort and an amazing response, and thank you. We could not have done this without you coming in and rolling up your sleeves. So there are so many things, more than 600,000 vaccinations that we delivered, more than 130,000 interpreter services were called for. We worked with the hotel quarantine, we worked with people on the vaccination lines, we worked with just the general community, and it was fantastic to see that sort of work happening as we go through. We treated more than 13,000 people in the community who were COVID positive that we managed to work with and help through the process. And fortunately, because the system responded so well and people were so reactive to the directions and the assistance they got, there was only about 250 odd people that came into hospital, about 53 that came into ICU. And so we had a really, really strong response to that, and it worked very nicely. Our total, at our peak, our busiest day, we had 4,191 COVID positive patients in the community. And we had a really broad model where we'd partnered with Medibank Private, we'd partnered with Calvary Mater, we'd partnered with Silver Chain, and how do we get the breadth of that? And then more importantly, the whole of the system stepped up and helped. We had Nepean helping us out, we had North Sydney helping us out, Royal North Shore ringing us every day saying, how can we help, what do you need? So the system at a state level really stepped up together, and it was really nice to see how that worked. I really want to acknowledge though every single frontline worker. Every day you came in, every day you put yourself into an environment that was uncomfortable, that we didn't know about, that we had to just trust each other and work together. and make sure that we were safe. And the only way that we were going to keep the community safe was to keep each other safe. So an amazing job frontline workers did. Thank you so much for that. It was just outstanding. And you know, I couldn't have had a prouder year than I've had this year to be able to stand here today and represent everyone within the district around what has been achieved. And it was just been outstanding. And there is no one who hasn't impressed me all the way through this. There's some real standouts. Our Doctor of the Year from the Quality Awards on Monday night, Dr Shopner Baggs, out, you know, 24/7 you could ring Shopner and get an answer around how did we make it safe. Now, we had a lot of aged care facility outbreaks. We had 36, I think we've got another 3 at the moment. So, you know, how to manage the aged care facilities, which early in the piece were difficult and challenging, became a routine process around how we do it. So it worked really, really well. But it wasn't just about COVID. We've done an awful lot in Western Sydney over the last 12 months. The wonderful new clinical acute services building at Westmead opened in February. We've moved in there, new theatres, new wards, new emergency department, phenomenal, brilliant, big new emergency department. A lot of extra staff came on board to work with us in that space. We from a Blacktown perspective, we started the new paediatric service out at Blacktown. So there's lots and lots of things that have happened in that space. And I guess no doubt you'll ask us about a few of them as we go forward. But you know, things like the welcoming garden and the work that we did in that space have been huge. And we've done a lot of work in the community or how we work differently with the community as well. We've embraced technology, we've embraced, you know, virtual care. We've really thought differently around how to provide care, and it's giving us some great opportunities in the future around how do we design and build Rouse Hill, you know, what can we do within the system, how do we take virtual care to the next level, that is not just virtual care but an in-touch care model where we come to the community, we talk to them about where is the best place to provide care and where is the best place to see them. And sometimes they come to us, sometimes we go to them, sometimes we can do it over a screen or a phone. So we've really embraced that, you know, what are the new models and how we can move forward and what are the partnerships look like in that space. The 2 other things, a really, really big piece of what we're doing is our culture piece of work. So that has really kicked in now, and we're doing a lot of work around our new strategy, which is called Our People, Our Place, Our People, and is a really important piece of what we do. So it's one of the 3 flagship pieces of work that we'll do over the next 12 months. It's a bit of a 5-year program, but working on the culture and working on the quadruple aim of, you know, patients and staff being pivotal in what we do is one of the areas that we'll work on. So that's a big piece of work this year. And just, I have to wrap up and talk about finances, even though it's, you know, not the most exciting of topics, but it was really good this year that Western Sydney, from an expense budget perspective, actually came in on budget, and that's the first time in quite a few years that we've been able to do that, and in a really tricky environment, which was COVID, around how that works. So from a budget perspective, the expense budget came in on budget, which was fantastic. When you consider it was nearly a $2 billion budget, to bring that in on in an environment that we had over the last 12 months was nothing short of amazing, and that takes everyone in the whole organisation, or 14,000 plus employees, to pull that off. Revenue was challenged over the year, and as you can imagine, with elective surgery and the changes to the activity and people coming in, you know, makes it difficult. So we didn't hit budget for revenue. We have some strategies for next year, but that's all I'll say on that, other than if you really want to delve into the numbers, have a look at the year in review book. It's got the financial accounts in there for the year, and you know, knock yourself out. If you're having trouble going to sleep, that's a really good part of the book to read. So thanks Jake, thanks for that, and back to you.
Thank you, Graeme. Thanks for that introduction. I look forward to asking you some questions later on, as well as the rest of the panel. I'd now like to introduce the Chair of the Western Sydney Local Health District Board, Mr. Richard Alcock.
We supported the organisation in one of our many other services. Everybody's efforts are important and have allowed us to deliver safe and effective care to the community. I look forward to the coming year, and the Board and I will continue to support the Western Sydney Local Health District to grow and thrive as an organisation.
That message. We're almost ready for the panel discussion, but before then, let's take a moment to reflect on the year that was. This video captures some of the highlights and achievements in the midst of yet another incredibly challenging year for the wider community and our health heroes as they battle COVID-19 on the front lines.
Now, I don't mean to excite you, but when you get inside, you're going to sanitise again.
Westmead Hospital's Narissa Grebbett has taught Howard how to walk again.
If you are able to get vaccinated, go and do it.
This is by far the biggest, the fastest and the best project I have ever worked on. So just remember that when this is all over, take some photos, take some selfies, remember where you were today, because today is the start of something huge.
As Kudos Arena opened its gates as a major vaccine hub.
It's the biggest vaccination centre in New South Wales. Hey, good morning to all you wonderful healthcare workers. The people...
Now, there has been a big win for the Western Sydney local health district.
The number of COVID cases in New South Wales continues to fall.
The transplant involved the use of this perfusion machine.
For me, this is the first major change in 25 years.
So the winner is Bernadette White.
Today's winner, Sharon. She works in the ICU ward at Westmead Hospital in Sydney. Thank you for being such a healthcare hero. Have the best time, the best trip.
I'm no hero, I just do, yeah, I'm not a hero.
What an incredible highlights reel. Now, the formal proceedings are somewhat complete. Now it's time to get stuck into the questions from the community as well as a few from me, myself, and I. We'll see how we go. Joining the Chief Executive in the panel today is Operations Manager COVID Vaccinations, Megan Byrne, Operations Director, Western Sydney Local Health District, Alison Derrett, and ED Specialist, Dr Kavita Varshney, who will be with us shortly. I'll let them introduce themselves. They know them.
Hi, I'm Megan Byrne. I'm the COVID-19 vaccination lead for the district. I'm overseeing all of our strategies from our public-facing clinics, including our Blacktown hub and our Granville centre, as well as our inpatient in-reach strategy and our numerous outreach clinics that are in operation.
Thanks, Jake. My name's Alison Derrett. I'm the Executive Director of Operations. I guess put simply, I actually manage all the general managers and service facilities, so across Western Sydney.
And this is your first year with Western Sydney Local?
Absolutely, is my first year. So I started in April this year. So it's been quite a journey over those last 8 months, but great to be here.
Fantastic. No, that's great. Thank you so much for being here with us today and letting me pepper you with questions. That'll be fun. Okay, let's jump straight into questions from the community first that we've received in the weeks leading up to today's forum. We're going to start with a question that was submitted a few days ago in regards to one of my favourite topics, which is Rouse Hill Hospital. I'm a bit of a fan of this site. I've been long awaiting more information about this one, so it's fantastic to see some questions submitted on this. Let's jump straight into it. So will the new Rouse Hill Hospital have a birth suite and a maternity department? Who wants to start off?
So I'm probably most involved in the Rouse Hill work. It's really too early to say exactly what will be in Rouse Hill. I mean, the beauty of this is it's the first time in decades that we've actually had a total greenfield hospital. That it hasn't just been we're doing an expansion, we're doing a new tower, it's actually a total new service. So what we've done is we've tried to think very differently around healthcare. So we've gone actually and worked with Macquarie University. We're doing a whole research project that says what does international best practice look like? What does a hospital of 2050 look like, rather than how do we grow an existing hospital that we've got at the moment. So they've done a huge amount of work, international research on what is good and what's positive out there. It gets complemented, and we triangulate that information with a whole heap of information that we've got from the community. So we went out to the community, we ran a whole heap of workshops on there and said, what do you want, what do you need, what do you think is really important, and what are the key things that you think Rouse Hill Hospital should deliver. And then we matched that up with, we went to all the clinicians, both in-house, some of our clinicians, and a whole host of GPs and other clinicians in the area, and said, what do you think of the clinical needs of that space? The one thing that definitely came out of it was emergency department. That's a no-brainer. Everyone wants an emergency department. I guess the challenge for us is what is an emergency department, and how can we make it work really well into the future. We haven't got to the point yet of then the service delivery and the specialties. So we're not at the point yet where we say we're going to have emergency and we're going to have an emergency, but we're going to have a birthing suite and maternity or neurology or cardiology, or we need to get to that point where the research is done. We link it up with what does that tell us, and what does the community say? So what we know the community says is they want integrated care. They don't want to know, I want to ring a GP, they want to ring a specialist, and I have to get another specialist, and they want just a seamless one health system response. So we've partnered with the PHN in the design as well, just to make sure that we have that full lens. They want the availability of care 24/7 to high quality care, and that's the emergency department piece. They want access to technology built around them. So many people are using their phone, so they want us to figure out how do we embrace not just a virtual environment, but a high-tech environment where we can they can tap into the system rather than have to sort of navigate their own way through. So we know that's there. Whether we have a birthing and maternity unit, I guess we'll come out at the other end of it. We know that it's a lot of young communities in there. How do we make it work? I guess the other big piece of that is, how do we think of the district as a network? So it's not just Rouse Hill has to do everything on its own in one location. Blacktown has to do everything on its own in one location. Auburn, it's around how do we maximise the benefits, and how do we bring the expertise to the people rather than having the people try to chase down the expertise. So we'll know probably around about April or May the makeup of the different departments that are in there, which will be the output of the next sort of the clinical service planning phase.
Fantastic. I guess one of the main concerns from residents is the fact that Greater Western Sydney, Rouse Hill, Kellyville, the northwest is such a significant growth precinct. Yeah. It's on average you're seeing up to 1,000 families moving into those communities on a monthly basis. I guess one of the questions is when it comes to a younger population, where we're seeing more babies born, particularly in Greater Western Sydney. Is that something that's on the radar? Is that something that you are looking at including?
Well, it's definitely on the radar, and it's one of the areas that we're looking at around birth rates. The other thing that we did that I didn't really talk about was we looked at the burden of disease. So we looked at what is the general population that's in there at the moment, what are their conditions, and what are they usually showing up for caring. Things like diabetes we know is one of those areas. Hip fractures, a lot of, not hip fractures, but orthopedics, so fractures and breaks. Which is probably as reflective as the younger population as well, around sporting injuries and those sorts of things. So we know there's areas that we will focus on, that we're seeing out of what's occurring out there at the moment. But yeah, we have to forward project for the next sort of 30 years around what is going to come through. We know we will have a growing population and a much faster growing part of Sydney than eastern suburbs, because that's where all the land is opening up. So it's definitely on the radar. The final mix will be really interesting to see what comes out of it. But whatever it is, though, I mean, the one thing the challenge that we've set ourselves is to say, what is it that we can give to Rouse Hill that no one else has got? Because we have that once in a lifetime opportunity to do that. What is the extra steps that we can take to make it better than the system? And I'm a huge fan of the public health system. Obviously, I work in it, so I would be. And I think it's one of the best health systems on the planet. But we can do more, and we can do better at Rouse Hill. And let's have a crack at it and see what we can get out the other side of it.
Fantastic. So we'll know April, May around.
Yep. Yeah, absolutely. So they've gone out to the market for the architect now. They're going out to the market for the engineers. Health infrastructure will manage all of that, so that won't be ours to manage. So timelines and deliveries and breakdowns of budgets and stuff, they can play with all of that. And we know we've got $300 million to spend because that was the announcement. And we'll milk every dollar that we can out of that, and we'll hold them to account around how we can get the total commitment, as we always do. But what can we really squeeze in there and think differently? Because it's hard as a system like as big as health to not sometimes be risk averse and not take challenges. But this is the time to challenge ourselves and think differently. So around about then will be when we'll know what we think will be in the building. A traditional model would have ended up with, you need 2 cardiology beds, you need 3 of these beds, you need 1 of those beds, and you can't run a hospital that way. It becomes a general hospital, which is fine. General hospitals have a really important part to play in the health system. But if we want to really have a leverage what's available at the moment, I'd like us to create an in-touch community health system that has 300 virtual beds in the system that is managed out of there, a high-tech centre to manage our in-touch care system. So that we'll be able to reach far more than just what are we doing inside the walls, but what are we doing with the GPs and what are we doing outside the walls.
Fantastic. Okay. Let's quickly jump into vaccinations. Obviously such a significant milestone across Greater Western Sydney this year. We've had an announcement today around children being vaccinated. Can you fill us in on what that will look like for Western Sydney? Yeah, absolutely. So we're currently in the planning phases looking at the rollout for our 5 to 11-year-old vaccinations. The plan is we're looking at early January in terms of that rollout. We're looking at all modalities across our vaccination program. So that would include our public-facing clinic at Granville, so at the Granville Centre, as well as our existing Blacktown clinic. In addition to that, we continue to do, we have a very successful in-reach program to the wards across all of our facilities in the district. To date, we've actually delivered over 1,500 doses through in-reach, which I think is actually a fantastic achievement. And in addition to that, we have an outreach program where we'll also aim to deliver some of those vaccinations. Our outreach program also is incredibly important. As part of that program, we aim to reach vulnerable communities, also our Aboriginal and Torres Strait Islander communities, as well as ensuring that we're reaching out to all pockets of the district, including the Cumberland LGA and the Blacktown LGA, making sure that we have full coverage across those with those clinics. In terms of health, we do know that in terms of those paediatric doses, that it is likely that the PHN will play a really big role, and that the GPs will do a significant part of that work. So we're expecting for the health hubs that we'll see about 25% of those vaccinations done across our hubs. The rollout is in line with the school holidays, so I think that is fantastic. It's an opportunity for families to come forward, to have their children vaccinated, to at least receive their first dose prior to commencing the new school year for 2022. So I think that's, it's really nice timing in that regard. Yeah. And obviously a great announcement today as well, having that timing come through. Alison, let's jump into a question that we received via email. Do you think it's possible for senior management to visit wards and departments on a regular basis to see firsthand what's happening to related staff in those precincts?
No, thanks, Jack. Look, I think senior managers really need to get out and be speaking with their teams. It makes a big difference when you're actually in the place where care's delivered and you're actually seeing and experiencing the sorts of things that staff are experiencing day to day. And it gives people the opportunity to actually tell you what's going on, to tell you what they're experiencing, any needs or things that are going on that you actually might be able to troubleshoot and solve. It's been really challenging in COVID to do that because we really tried to stop people moving across facilities for the obvious reasons. But now we've been able to get out and about, and I guess this week I spent a morning out at Auburn Hospital, which was great, looking around the wards and talking to the general manager there. And just yesterday I was able to spend the day at Mount Druitt and was able to meet with a group of staff and talk through some issues. So absolutely, I think it's a no-brainer, really. We actually need to be out on the floor talking to people. So absolutely agree.
Fantastic. Thanks, Alison.
Yep.
Wayne Thompson, who's a nurse educator at Blacktown and Mount Druitt Hospitals, asked this question. Graeme, I think we might go to you on this one. Can the district elect or appoint staff members to the board? And if so, when will this occur?
Okay, so that's a really good question. So the board appointments, I guess at the highest level, they're ministerial appointments, so they're all appointed by the minister, so we don't get to appoint. What we do is we encourage through the medical staff councils to make sure that they put some nominations up, and then we support them and send them through to the election process. They are open to everyone anyway, so all staff can apply, anyone can apply for a board appointment, and there's a recruitment process that they go through to do that. So we don't get to nominate who are board members. As I say, the medical staff council structure gets to nominate, put up a list of a maximum of 5 each time the recruitment process occurs. They did again this year. They for the renewal that's just coming through now for the new board members that will start in the new year. Some of those were nominated through the Medical Staff Council. So we are expecting that to be announced in the next day or two, hopefully, around who the board members are, and that's a process that goes all the way up through the minister. So we can support them. They're open to anyone to apply at any time, but it is a ministerial appointment process. So they tend to ask the board chair more than they ask the chief executive.
Would you like to see staff members?
Oh, absolutely, absolutely. Yeah. One of the greatest benefits is having clinicians on your board because they understand the business in which you work. And it's not just the business of running healthcare. The key components of research, innovation, those sorts of things can be a bit opaque to a board member to understand, because research is a tough world. It's it's a little bit different. If you're a non-clinician, I'm a non-clinician, it takes quite a while to understand the research environment, how it all fits into the system. So that's one of the real strengths of having clinicians on the board brings.
Fantastic, thank you. There are several other questions here before I go into my own, and obviously we will monitor what's coming through on social media as well, but Alison, this might be one for you. When will town hall forums recommence?
They're starting to recommence now. Certainly they will go in sort of strength to strength early next year. We're really committed to getting out and talking to people and getting out and doing rounds. So it's really links very closely to the people and culture strategy that Graeme referred to, and that's about getting out, hearing from people and being able to tell people what's happening as well.
Fantastic. Megan, we might just jump back into Indigenous communities when it comes to vaccination. What are the kind of opportunities that you've looked at to try and encourage more, a greater Indigenous population to be vaccinated?
Yeah, so more recently we had an Aboriginal vaccination hub set up called Kimberwali, which was in Wayland. And that centre alone, we vaccinated over 1,700 recipients through that centre. We very much engaged with the elders and the local community. We very much set it up to be, a culturally appropriate space. We had a yarning circle so that people, felt comfortable coming in, being able to have a chat. There was no time pressures throughout that whole process. We recognise that there can't just be one strategy. We have there's lots of different needs in different pockets. So our outreach service also always has a component of that service is reaching out to the different groups in the community and providing vaccinations for that particular population group.
Fantastic.
So yeah.
Oh, that's wonderful. That's great. Okay, not surprisingly, I've gone through all of my notes over the past year and developed a series of questions that we can work through the panel now, so let's jump in. Starting off with palliative care. Graeme, on October 14, you announced that Westmead Hospital's palliative care ward would be reopened. We haven't seen an announcement since then. Prospect State Labor MP Hugh McDermott and the Westmead Push for Palliative Care team have asked me a series of questions. I'm going to forward them on to you. That'll be fun. Let's start.
I'm sure I've heard them all before.
Of course. When will the timeline be announced for Pal Care at Westmead?
Yeah, so I'm shocked this came up as a topic. Yeah, look, I just as a point of clarification, because there's a bit of misunderstanding. So I didn't announce opening of a Pal Care because it's not my job to announce opening of anything. That's the Minister's job. What I did is I gave our medical staff, our senior medical staff, an update on the progress of the review that we're doing, which one of the recommendations is to reintroduce a palliative care unit in Westmead. We talked about that as a district and as a board, and yes, we absolutely support that. And so the process for that review that occurred it's gone through the executive, it's gone through the board. We support all of the recommendations and endorse them. I've got it into the ministry at the moment to make sure that I'm not going off in a different direction than what the planning at a state level says we should be doing. So once we get that back and get that endorsed at a state level, then we can take that out and make the report publicly available. But of the 18 recommendations, we are well and truly starting to implement some of them anyway. There was already a piece of work we were doing that we're funded to introduce palliative care at Auburn. So that work is happening now and the planning work has already commenced. And so we'll have that up and running before the end of this financial year. So by June that'll be in and running. We've just got to do a little bit of capital work in there. With regards to getting a new service up and running at Westmead, it's now a question of, okay, if we agree this is what we need and everyone supports it, then where do we put it and what do we have to do to make that work? So there's a bit more work down the track around where does it best fit, what are the options, what are the costs to do that, let's get it funded and then we can get it built. So it's a bit hard to put a timeline on it at the moment around, there's going to be an awful lot of activity over the next 12 months around capital. Because the site's really got a lot happening around the Children's Hospital, us finishing the renovations for stage 3, the new dermatology area, there's a whole host of stuff, so we've got to fit it in there around how to make that work. So I need to work more closely with the ministry, understand what that is. We actually have to do an options paper first, which is talking to the community, talking to our clinicians around what are the best options to do to put it. Because as you can see there's so much happening on the precinct at the moment. So options paper first, work with the community, work with our clinicians, look at where the best ones are, take that to the ministry, get a commitment for funding to build it, and then we take it off from there.
Do you have a timeline of when you'd like to see those stages completed?
Gee, I'd like to see them done really quickly, but there are so many priorities and competing commitments for us for time to actually do design work, plus for the ministry. So I would suggest it's probably going to take us at least 3 or 4 months to go through that options paper around, where are the best locations, what's vacant now that we've moved people into the new build, and what is involved in converting that space into a palliative care space. And the review basically says we need a dedicated space that's purpose built. Not exactly in that language, but so it's not just slot them into an existing old inpatient unit, because that's really not that friendly for palliative care. And the other piece around how do we network? So how do we get the Mount Druitt Pal Care with the Auburn Pal Care with the Westmead Pal Care all working together, plus the work we do in the community. So I would like to have that option stuff over the next 3 or 4 months finished, so we've got a final plan that we can go to. Then we'll work our way through it with the ministry around funding and how to make it work, and then hopefully out of that we can have some timelines on when it's going to happen.
The paper so far, has that made any recommendations on the number of beds that will be required?
Yeah, it says 8 beds for Westmead. Okay. So there's 10 beds at Auburn, there are 16 beds at Mount Druitt existing. There was a recommendation of 8 beds for Westmead. There are 20 beds for St Joseph's, so there's already about 50 beds in the district at the moment. When we add the extra 10 in at Auburn, it'll take us up to about 60.
Fantastic. Okay, no, that's wonderful. Again, going back to the paper, is there any kind of understanding of the number of specially trained staff that will be inside the new facility at Westmead?
So it didn't go to the level of, for this many beds you need this number of staff, so really it will come out of that design. So the role of that Westmead service here will be that really acute phase of palliative care, so they may come in, have some acute work done that's necessary, and maybe do some end of life. They come through ED, but preferably they come through an acute phase of palliative care service delivery, and then maybe do the end of life or the subacute work at Auburn and Mount Druitt, and network those together, so it's a really appropriate environment to happen. So the staffing required will come out of the other side of it. We know what we're looking at for. Well, we have a good measure for us at Mount Druitt, which is an excellent service and gets really positive feedback all the time. Has a really strong Aboriginal service in there, which we've built over the last sort of 2 years. So we'll model that for Auburn, but the acute piece, I really need to talk to Dr Kavita Varshney and the others to make sure that we get the model right around dedicated specialists and particularly dedicated nursing staff that are skilled and trained in palliative care, because that's when you have it in an oncology service, that kind of gets diluted a bit. So we want to go back to having that dedicated staff again.
Great segue to Mount Druitt. That was something that I was kind of toying with my questions. Was Greater Western Sydney has quite a significant reliance on Mount Druitt currently, in the PN not having its own palliative care designated facility. Quite a number of patients move to Mount Druitt. Will the works at Westmead impact Mount Druitt at all in a negative way?
No, not in a negative. It will actually complement Mount Druitt. So at the moment, if there's an acute intervention needed, they'll have to be transferred. It gives them a location to come to. It may be that they would need to go to Blacktown for something or other, but predominantly Mount Druitt is that subacute end-of-life palliative care. So that won't change. It will just give us more options and availability for pal care. I'm not sure about Nepean Blue Mountains and what they have, so I guess that's a question for Kay and the team out there around what their model is, but it will actually enhance and give us more options. The future for growing pal care actually still sits for us in an end-of-life subacute model. Mount Druitt is an outstanding model for it, so it's an area where we are really strong out there, so we need to make sure that we grow that as well.
Fantastic, thank you. Let's jump into Blacktown. Obviously several questions on this last year and something that is obviously quite a significant issue to the community when it comes to the issues that came out of the maternity ward. Have increased staffing levels been achieved when it comes to the maternity unit at Blacktown?
Yeah, absolutely. So there's an extra 15 FTE midwives gone in, an extra 3.7 FTE consultants have gone in, and I think we've got a vacancy of about 0.7. Sometimes it's a challenge to recruit, but yeah. So the midwife numbers have gone up, the consultant numbers have gone up. We're in the process of recruiting an additional 13 FTE midwives because we did our birth rate plus assessment and we needed to up our numbers again. But we've done other things, so we've added in an emergency Caesar theatre that wasn't there before, so there's now access to a theatre that's dedicated for emergency Caesars, which was a big piece of work for us. We've opened up some extra gynaecology clinics, so the O&G sort of works together, so there's more clinics available to make sure that we bolster it through. We've got a new head of department who is just outstanding in that group, that's working really well with us. So it's expanded quite significantly. I think we've actually increased our coverage for junior doctors overnight as well. So there's now 2 on nights rather than the 1 at the time. So the numbers are better. Recruiting is always a challenge.
Of course.
And we're actually working with a couple of the universities to see if they can up their numbers for midwives training so we can get some more into the pool for midwives into the future as well. So. That's the other piece of it. How do we keep growing the numbers? Because as birthing grows, the staffing group needs to grow with it. So we need more training to be done as well in that space.
Last year we spoke about the number of obstetricians that would, I guess, be required and that were committed to. It was around between 6 and 8. Have they been?
So all of the obstetricians there, so that was the extra 3.7 over and above what we had before.
Yep.
So we've now got as I say, apart from I think 0.7, we've got a full contingent out there, and we worked at that number with the consultants that were out there, the obstetricians, to say what is the right number for the number of births that we've got. It's going to be something we're going to have to keep doing on an annual basis and review, because we can tell how many births we have now and say what's the right number, but in 12 months' time, if we've got another 500 or 600 births, then we might have to up the number again.
Which is what we've seen at Blacktown. We've seen constant growth.
Yeah.
So of course.
Yeah.
Okay, let's jump into locum doctors. I know we spoke about this last year, but it was something that I did want to jump back into. Are there still emergency locum doctors required throughout the health district? And if so, where are they? Alison, Graeme, do you want to jump in on?
No problem.
Look, yes, locums are still in use and will always be in use. I mean, they play a strong role around, leave relief, or if we struggle to recruit. We often use locums in EDs when towards the end of a training year, you might see a few of your doctors in training sort of find a permanent job and leave a little bit earlier. So you end up at the end of the year, you end up with quite a few gaps in your junior medical workforce. So we use locums to supplement that. So there'll always be a role for locums in the system. The question for us is how do you make sure that you minimise it from a staff changeover perspective. But some of the locums are great, they've been there for a long time. But also you want to make sure that you have an ongoing relationship with your clinicians and they have an ongoing relationship with the facility. So, it's not a new day. So if someone new comes into a facility starting a new job on day one, you're unfamiliar with surroundings.
Of course.
Yeah. So, it's good if you have locums, if you can keep a pool of the ones that you use regularly to make sure that risk of a new face is overcome. But yeah, I think we'll always have locums available and in the system, and they're an important part of the workforce. It will be interesting to see workforces of the future whether staff go more down a pathway of opting for more casual type roles and shorter appointments, maybe 0.8s rather than a full FTE, as lifestyles change and we start to think differently around what is our work-life balance and our commitments.
Fantastic, thank you. This might be something that we can open up to everyone. Okay. I'm quite interested to get your perspective on this. What's the Health District's 10-year plan when it comes to the future of health for Western Sydney? Are there any particular things that you would like to see?
Well,
Alison, go on, jump in. I know you want to.
The planning department.
No. Yes, well, we're about to actually go into our new strategic planning process, and I guess just closing off the last one and moving into the planning in the next 6 months. What's really important, I think, for us is that, and Graham's touched on it before, is that community connection. So really understanding what our community needs are and having that match with the services that we're providing. And so that will be a reasonably large piece of work, but moving through the next 6 months, actually going into a consultation process for the next sort of 5 to 10 years as well. If you wanted to add anything.
Look, I think the other thing to add around, we want to sort of think differently around our 10-year plan. There are some really critical parts that I think we need to have a refocus on, and sustainability is a really good one. That it doesn't tend to make it into our clinical services plan because it's a clinical services plan, but in reality, what I think our 10-year strategic plan needs to be is a contract with the community around what can they expect of us. And I think sustainability is a big one. We've got to take ourselves out of our normal pathway and see what is our responsibility to the community about not just the care that we provide, but the impact we have on the local community as well, both from an employer perspective and a culture perspective, but also what is our environmental impact, and make sure that the new staff that are coming through now, they're going to replace us when we all go, are left with a legacy that's as good as we have now, and what can we do to improve it. So I think things like culture, things like a contract with the community about sustainability, around what is our direction and future of healthcare, marrying it in with the 20-year future plan that the state has, so they have a future healthcare plan. So what does that ask of us as well as a community? How do we link all of that together? But I really want to get away from this building, this number of beds, this number of people, into this is our social contract with the people of Western Sydney, and this is what you can expect of us.
Fantastic. Thanks for that. Dr Varshney, I might jump to you now. Looking at the new ED facilities at Westmead, can you give us a summary of what this year has been like when it comes to, I guess, becoming acquainted with that new facility as well?
So 2021's been a very exciting year for us. A lot's happened. So firstly, as you alluded to, we moved from our old ED where we'd been for about 40 odd years, and there was such a familiarity with the space and where we fit in the complex, to sort of being part now of a bigger precinct and more. I mean, it's very exciting. There's a lot happening all around us. I think we moved at just the right moment because COVID happened just after we sort of moved and just acclimatised to our new spaces. The new space did give us an ability to section or quarantine patients or cohort patients more effectively, because we had sort of different models of care that we could utilise. We had a much bigger waiting room area that we could expand into, and other spaces we could use. So yeah, that was a sort of lucky moment for us, I think. In terms of now getting back to what we'll call sort of more business as usual, or business with COVID, or living with COVID, I think people are still enjoying that new space. It feels modern, it feels bright, it's light. In terms of education facilities and like meeting facilities, technical facilities, much improved to where we were. We'd outgrown ourselves, I think, before, and I think both staff and patients are enjoying the new space.
Fantastic. Okay. Jumping back into to the future of health, and this is something that came out of the parliamentary inquiry that we were looking into last year. It was broadly focused on Greater Western Sydney, but there was some kind of pinpointing arguments that were made throughout it. Figures tendered at that parliamentary inquiry revealed that the budget for Western Sydney Local Health District has been set at around $1,750 per resident. I know that's not how you guys obviously assess funds, but that's how the parliamentary inquiry looked at it. That's almost 30% less than the $2,500 budgeted for those who live in the Sydney Local Health District. Do you feel that Western Sydney residents get their fair share of funding? And I guess a second point to that question is, should more specialist services be provided closer to where people live, predominantly in Greater Western Sydney, so they don't have to commute outside their LHD?
I'm guessing this is definitely one for me, yeah.
I wanted to go there.
No, look, it's a really hard question to answer because it's not apples for apples. The services at RPA or Prince of Wales or North Shore are long entrenched and have some very statewide specialised services that tend to skew those dollar figures when you talk to the, is it equitable funding? I guess the way that we look at it, the reason why we don't look at it that way is because it's quite complicated. As Westmead grows, and Westmead is one of the big five, so to me the big five: Westmead, RPA, North Shore, Liverpool, Prince of Wales. They're the really big ones. St George is really busy as well. A lot of comparisons between that, and we do a lot of specialist activity and services out of Westmead. A lot of cardiology work. We know that we do gene and cell therapy work really well. We know that we're moving into some really strong research areas. So we have a lot of stuff that we do statewide services already. So it's not that they're all in the east. They are spread, and the system works really well, and we partner together. I guess the question of comparing one district to another is really challenging because of that. We really need to think of it from an activity-based funding perspective around, when we normalise what we do, and like it or not, we have a weighted activity unit that we use, which has got to have some way of measuring it. It's a pretty boring way that we do it, but that's how it works. We are quite efficient, so we probably are more efficient at providing that activity than others. You could say that's a factor of funding. Maybe it's a factor of funding. Maybe it's a factor of we're very good at what we do. So the system is driven around the efficiency of how service is delivered. I guess the challenge for us is not necessarily the comparison between districts, but the socioeconomic disadvantage and the burden of disease that sits in Western Sydney, and are we doing something about that to try and address that? So we are. So we've started a program of equity funding where we go out to our clinical workforce and say, we've got some funding here. If you can tell us a project that that you want to work on that addresses inequity, and the inequity is inequity of access to care. It's not they've got 3 and I've got 2 and I want the same. It's how are your patients not getting the same access to care as someone else might do. And so we had lots and lots of, we had about 99 responses. There's several $1 million in that funding pool that we do now, and we've created this equity pathway. Now, it has no activity attached to it, so it's not, we'll give you some more money and you have to do more. It's we'll give you some more money, you don't have to do any more, but let's do it differently, and maybe we put some interpreters in there, or maybe we put some an Aboriginal health worker in there to create some cultural sensitivity, or maybe there is a staff member that we need because we just it takes us too long to see patients. So there's a lot of funding this year around how we do that, and so we will continue to build an equity lens on how we allocate our funding out to try and localise our challenges around particularly socioeconomic disadvantage, which means it's harder to get to a GP. They might come to hospital a bit later in their journey of illness, so that might take us longer to work up with the patients. So we will work in that space. We will always advocate on behalf of Western Sydney, and as we go into a funding cycle, I'm always keen to push the cause for Western Sydney around trying to get as much funding as we can, noting that there's a finite bucket of what we do, and it's not just a comparison on a per head basis, because a lot of people from Western Sydney may travel to somewhere in Eastern Sydney to get particular care, and that's okay. Because at the end of the day, people get to choose. I mean, some of our services, people travel from all over Sydney to Westmead to come to.
Of course. Yeah. I guess that's one of the major arguments is, and something that we had frequent conversations with the Minister about, was the direction that people want to take when they come to their care. They want the best in the business, so they will travel for it. But I guess I'd like to see more centralised services, or decentralised, into Greater Western Sydney rather than the eastern suburbs, as a Western Sydney resident myself, but we won't go there. Look, let's jump into Rouse Hill. I know we touched on this previously, but I have a whole swathe of questions for you, so why not go for it? We've already focused on how plans are progressing, but I did want to jump in. Will you guys commit to an ED in stage 1?
Yeah, 100%.
That's what I like to hear. Fantastic. Okay. So when do you actually expect the hospital to open?
I was going to be cheeky and say, when's the election cycle? No. No. There is a program in there. Off the top of my head, I can't remember, because it's sitting in with Health Infrastructure's Forward program. So I couldn't give you an end date. They usually take somewhere between 2 and 4 years from when you start doing the design process to when you get the keys and turn them over. So it would be in that range. I
guess there is a commitment to see work start before the next election, so we know that that's locked in.
Yeah. So once work starts, it takes, it's 18 months to 2 years to build. You know what I mean? So once you've shovel in the ground, the building program itself doesn't stop for anyone. Maybe a pandemic every now and then it stops for, but other than that, it's a production facility around how we do it. So, and HI are really, really good at delivering, budget buildings within budget within the right time frame. So, I expect that we'll see a shovel in the ground in the next, let's say, 15 months, and then the building program itself usually comes in a bit under the 2-year mark. So there's a bit of negotiations at the moment around the location's locked in and we know where it's going and all that sort of stuff, which is good. The town planning piece around that is really critical for us now, because as I say, normally it's just a site, so you already know where your driveways are and where the site fits in, but now we have to design it in around the new site and the new Rouse Hill area, so there's a little bit extra work in that space.
Yeah, okay, no, that's great. Speaking to the opposition health spokesman Ryan Park before this event, he was quite concerned that Rouse Hill would be somewhat of a glorified medical centre, because he wanted to know the kinds of specialist services that would be provided there. Is there anything that we can forecast at this stage?
That goes back to what I was saying before around that sort of April, May when we get the clinical services plan. It won't be a glorified medical centre. It'll be a proper hospital, and it will service the community of Rouse Hill really well. What we're trying to do is say, what does the next gen of hospital look like? Not do we build what we've always built, but what does the next generation of hospital look like, and how do we embrace things like technology and things like the community and the primary care and the GPs in that process around taking hospitals to the next level. And if we do it well, we'll set the standard for hospital developments into the future.
Fantastic. Kavita, let's jump back to you. Looking at improving staff in the ED across the LHD, particularly at Westmead, can you talk us through that process?
So there's been significant, I think Graeme might want to give some of the stats about it, but there's been a number of appointments. We've got some of the key roles, which are not necessarily frontline clinical roles, but supporting roles, so equipment officers, nurse educators, all of that which supports our clinical staff to be able to provide the care that is so important for our community. You can see he's got his numbers out now. Did you want to?
So I knew you'd ask that question, so I actually brought down the numbers because I also knew that I would forget how many there were when you asked me. So there's a lot of staff that we've put in around the emergency department. So just quickly, there's additional nursing roles that have gone in permanent, 24/7 ambulance offload nurses, 2 clinical resource nurses that are 24/7. Nurse educator additional that's gone in there, equipment officer additional that's gone in there, 5.5 FTE and allied health workers in a specialised program to try and how do we help people into allied health through the pathway quicker. Since 18-19, because that was some commentary around we've done nothing for 3 years. Since 18-19, there's an extra 11 FTE in nursing. There's 138 total FTE nursing in there at the moment. There's an additional 6.3 FTE of medical staff, which gives us 93.5 FTE in medical staff. So there's quite a lot of work, and there was a lot of stuff we did in COVID around how do we change our models of care, and brought a lot of people from outside of ED into help, particularly some theatre staff that came down to support and assist. So there's been a lot done. There's a lot more we can do, and we've sort of met with the staff, and we're going to pull together a working party around what is the next version of it, because it's a bit like the maternity discussion we had. We can fix it for today, but tomorrow we get busier, and then you're having the same conversation again. So we're going to try and get a bit in front of the cycle and see what we can do. And I think some of the areas that we can work on around, how do we look at mental health patients in the emergency department? It's one of our biggest challenges around mental health patients in an ED, and that's pretty consistent with most emergency departments, to be honest. How do we work that so we have a multidisciplinary model of care and make the patient's journey much quicker. Some of the things around security and some of the things that we've learnt over the last sort of 12 months, particularly around COVID, and what does that mean? Some new models that we can do. We probably have too much of a reliance on some contract work in security that we can insource and bring them in-house to try and make sure that people are trained well in that space. So there's been some good suggestions already from the floor around what we can do differently. It will take us a few months of sitting with the staff and working our way through it.
Fantastic. Sorry, I'm just checking the questions through social media, and one of them was about recognising staff who have altered, had new responsibilities put to them when it comes to COVID-19. Is there any particular way that you'd like to recognise staff? Who wants to jump in? Alison?
I can jump in. Yeah. One of the things I've really liked about being in Western Sydney over the last 8 months is getting out and talking to people and hearing their stories and what they've done. I think what Western Sydney, and we're really lucky in, is that we've got some people who have been, and quite a lot of people, not just some people, a lot of people who have worked with us and committed their careers to us for a long period of time. And that can be upwards of 20, 30, sometimes 40 years, people who have been here since Westmead opened, and that's pretty amazing to have that level of commitment. Certainly in COVID we did ask people to do things differently and move into different models of care, and we really very much appreciated that flexibility and I guess that agility in moving into those models. Some of the ways that we recognise people, I guess, is through our quality awards that we had. I think it was Tuesday night we had, and we had some a great night, but some amazing entries in terms of, in the midst of all the change and all the models, people were still able to really present and celebrate the work that they've done. So that, I guess that's one part of it. I guess the other part is really recognising people for that years of service, but that, it's not just the years of service, it's the time and the commitment and the energy that they've placed into developing services for Western Sydney. And so we've commenced a years of service recognition program that's starting to roll out now. So we're just going through our records and identifying those key people who have been here for a long time. But certainly very much appreciated the flexibility and the agility of our staff over the last couple of months in particular.
That was actually the next question when it comes to the 20-year service badges. Do we know when they will be rolled out?
They're rolling out now. Okay. So probably, again, it got a little bit held up because because of what we were dealing with at the time, but they're certainly on their way out at the moment.
Fantastic. No, that's great. I've had a couple of messages come through. I'm just going through them now, just to see if there are any that we have not answered. One comes from Kathy Van in regards to the Westmead Hospital's palliative care services. She's looking at the partnerships requirement when it comes to plans to reopen the palliative care. I know you touched on this before when it comes to partnerships with community and identifying, having them involved in that conversation. Is that something that you'd like to progress on?
Oh yes, so we'll definitely involve
planning, design, delivery.
Yep, the consumers in that process around what does palliative care look like. Our Pal Care team is really strong in community engagement. We've also got a strong relationship in the community with Silver Chain, so you know, it's that end-to-end journey around what does palliative care look like that we need the consumers involved in. And I think it's fair to say that there's a fairly active and enthusiastic consumer group out there that are keen. Philip Lee, who was one of the strong advocates for it, which was the former head of department for Pal Care, he was actually involved in our steering committee piece of work around the review, and will be involved on an ongoing basis in how do we implement. So we'll get some consumer reps in a formal way, but we actually need to consult with the community around what is the expectation of Pal Care as well.
Yeah, fantastic. No, that's great. Look, that's all we've got time for when it comes to questions. Graeme will have a bit of a chat with you in a moment in regards to his final sign-off for this afternoon.
Okay. Yep.
Yes, fantastic. Look, I just wanted to say thank you so much to our panel for taking my questions and taking the community's questions as well today. It's wonderful to be back, and I really appreciate being able to be here and discuss these significant issues with you all. I do really appreciate it. So, Graeme, I'll hand it over to you.
Thanks, Jake. Look, I guess I just want to finish up by saying a couple of thank yous. One is obviously to all of our staff. It's been a huge year, and it's been an amazing year. What I was saying in the Kudos Bank snippet that was on the grab there before was, have a think about where you are at any time this year around what we're doing, because this year's been a defining period of time for us. Many people, none of us have seen a 100-year pandemic before. Some of us have been through swine flu and a couple of other ones, but it is nothing. It pales into insignificance around what everyone's gone through, and it's just been the most amazing effort from all staff. So first of all, thank you. You're an amazing group of people. I'm enormously privileged to be able to be a chief executive for Western Sydney. I actually think Western Sydney punches well above its weight and does a fantastic job. And in a lot of ways led Sydney out of what was a horrible pandemic. I guess the other big thank yous are that, and it follows on from that. So the leadership that we got from head office, the Susan Pearces of the world who really helped us through every change and every iteration of what we needed to do. The way that my peers came together and helped us when times got tough. The way that the system comes together every time there's a disaster anywhere, whether it be bushfires or floods. I see the whole system pull together and put their hand up and say, do you need any help? And we got that help when it got really tight. And from the ambulance service all the way through, they were fantastic. So to the other districts and to my peers, thank you very much for that. The ministry, their support was really, really strong. So it would have been a much tougher environment without that. And the last thing I just want to mention is the board. So boards don't really get a lot of kudos because they're in the background, but we have a really strong board. The board chair, Richard, who you saw on the screen before, is a fabulous board chair, and the whole board has been extremely helpful. If I ring any one of them up and say, do you know people in this area, can you get some thoughts in that? They are enormously strong. They ring me up and say, do you want any help with culture? Do you want any help with mental health? Are there any areas where you needed some support from where we can bring our years of experience? So, we're very lucky to have a strong board like that. So, I want to thank the board and the board chair for all their support and all their hard work through the year as well. But other than that, it's, 2 weeks till Christmas, and everyone's got to have a break. I want everyone to get some time off. I want everyone to wind down. It's been a really, you think the last 3 Christmases were either bushfires, COVID or COVID. So I'm really hoping that everyone gets a chance to have a break, gets to take some time off. I took a couple of days off. You don't realise how tired you are until you don't have to get up for work in the morning, and then you realise you want to stay in bed for a couple of extra hours. So, I really want everyone to have that reset and be able to do that, because next year we'll still have COVID around and we'll still have to deliver everything that we do. And so, we'll be back to refresh and recharge. So get a break, have some time off, have a very Merry Christmas or whatever holiday that you want to celebrate. For those of you who are working through, thank you. Everyone in Sydney and Western Sydney appreciates the hard work and appreciates you being there on the days when they need you most. So thank you to everyone.
Fantastic. Look, thank you so much for joining us for the Western Sydney Health Forum for 2021. If I have missed any of your questions, I apologise. You can forward them through to the local health district. Send them to me as well. I can forward them on to the district. The email address that you can use is WSLHD-corporatecomms, COMMS, at health.newsouthwales.gov.au, or you can forward it through to the Facebook Live, and we can get the health district to answer the questions from there. Thank you so much for joining us, and thank you to the panel once again. Appreciate it. Thank you.